Medical workers of Reddit, what were the most haunting last words you've heard from a patient? My uncle was born with Down syndrome. He was 42 when he died but had a mind of a 3-ish-year-old. He could do things like brush his teeth, dress himself, etc. but needed prompting and supervision. My GMA, his mother, died in 1974. My uncle died in 1984. The night before he died he told all of us that Mama came to see me last night. My dad asked him if he had a dream about Mama. He said no. She sat on my bed with me and told me she was coming to get me soon and take me home with her and not to be scared because it was all okay. We dismissed it. 24 hours later he was dead. He died peacefully in his sleep. Thanks for the award. I'm new so I don't know what it means yet but AWW. That is wild. Having a small experience with someone with Downs, they don't typically lie. It wasn't words, but the most haunting death was a patient who was DNR. Through her and her family's wishes. She was losing her battle, and her family wasn't there. She was getting frantic and looking around and half sitting up in bed, and a nurse with more experience than me took her hand and calmly said, "It's okay. You're not alone. We're right here with you. It's okay to leave." The patient immediately calmed, put her head back on the pillow and died. I knew I wanted to be that nurse when I grew up. How the heck did she know just what to do and say? I've never forgotten it. My mom passed away a couple of hours after I told her I'd be okay and that it's okay for her to go. I've always hoped that I was able to give her the peace of mind she needed to let go. My pop died of lung cancer. The last lucid thing he did was wake up just long enough to sing "Show Me the Way to Go Home." I'm tired and I want to go to bed. I had a little drink about an hour ago and it went right to my head. It was really pretty amazing and freaky at the same time. Frick cancer. My sincerest condolences to everyone who has lost someone to this horrible disease. Dad was over 80 and had smoked for a lot of his life. I still miss him but he lived a long life and his time had come. I've lost a couple of friends who are my age to cancer and those deaths are much harder to accept. He was a foot soldier in World War II and he sang that song while marching through Germany, I believe. Working caregiver in my earlier days, I overheard an old woman console her dying husband. Went like this: "Damn it Jim, you have beat so many things in your life. For heaven's sake you beat that murder charge for that guy you killed. You can beat this." She did not know I was listening. Dude died the next day. Nurse, in hospital caring for 40-ish man with brain tumor, coming in and out of consciousness, not to be resuscitated. His 16-year-old daughter was crying non-stop for 12 hours. His wife, who had been given a few months to prepare herself, was calm and focused on her husband. I had to routinely check his level of consciousness, which involved talking to him in a loud voice, response to auditory stimulation, which I did not like to do. So I asked his wife to do the loud voice part, so the voice he would hear would be hers, not mine, and she did so without hesitation. The only response we observed with her vocalization was that this by now profoundly unconscious patient took her hand to his lips and kissed it. He stopped breathing very soon after that. I am haunted, but not in a bad way. Had a patient on the cardiac ICU during my second month of intern year who had newly diagnosed heart failure that we couldn't figure out what caused it. He was a healthy guy, in his 60s, did yoga every day, walked a few miles 5 days a week. Genuinely nice guy, which is always a bad prognostic sign. With his heart failure, his heart was so stretched out and not squeezing adequately to provide the blood and subsequent oxygen he needs to the rest of his body. A few nights into his hospital stay, I come in the next morning and discovered that the senior resident had to code him for sustained and stable heart arrhythmia and stable VTAC. I went and talked with him about it the next morning and he told me that he was in and out of consciousness during it all, from the low blood pressure, but he compared it to the feeling of jumping out of the plane and skydiving. Later that morning I was checking on him again and he didn't look so good. He goes into the arrhythmia again, drops his blood pressure, and is in and out of consciousness. As I'm charging the defibrillator to shock him again, he comes back around to and briefly and asks me if I'm taking him skydiving again and lets out a nervous laugh before losing consciousness. Having surgery tomorrow. What the frick am I doing here? You are all super kind, wonderful people and I will almost certainly not haunt any of you if I kick the bucket tomorrow. Surgery went well, I am home and resting. For the record, my not final words were as follows. Anesthesiologist, we're giving you the anesthesia now, you'll be asleep in just a few seconds. Me, stoned on the don't panic drug cocktail. Okay, sweet dreams honey. Everyone else in operating room. Ha 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 ha. So I went under to the sound of laughter. Not a bad deal at all. Again, thank you all for your kind words and encouragement. Zadax has entered the chat. Not a medical worker, but I went with my father to say goodbye to my great uncle. His uncle. He was suffering from dementia and clearly on the way out. He no longer recognized people. My father was an only child and spent most of his time being raised by his uncles, as his father ran a farm all day. Anyway, we're sitting there and great uncle is snoozing. He suddenly wakes up and clearly sees my father and starts talking to him about a barn and describing it in great detail. Like, he's talking about where it is, the way the paint was flaking off in one corner, and so on. My father is quieter than normal and just saying yes over and over as he describes the barn. Then, just before great uncle loses consciousness, he describes going into the barn and setting it on fire. Turns out that my grandfather and great uncle were having a hell of a dispute at one time and burned down the barn to get back at him. Everyone suspected, but never knew for sure. Looks like I forgot the last words. Most of them were mumbles, but he spoke about how the fire lit up the night and how it took a while to catch. I've heard a lot of stories about dying people with dementia suddenly getting incredibly lucid and back to normal just before they die. During my residency I was on call and running the hospital, as senior residents tend to do. One of my responsibilities was being in charge of the entire ICU, which had about 16-20 bed capacity. I was taking care of a man who had a bowel perforation, a hole in his intestines. He had a NG, nasogastric, tube up his nose into his stomach so that he wouldn't drown in his own feces. His brother and sister-in-law came to visit him and they had a nice conversation. I walked in as they were leaving and they said to him make sure to listen to the doctor as they left. The patient and I talked a bit and he wasn't looking so good. I kept hearing a gargling sound as he was speaking to me. The kind of sound you make when you rinse out your mouth with mouthwash and spit it out. I immediately checked his NG tube and it came right out. He looked at me and said I shouldn't have played with the tube. Before going pale and losing a pulse, I did everything in my power to save him that day, but his lungs were full of stool and he died 20 minutes later. The rest of the day I felt utterly numb and it still sits with me to this day. To have a patient smiling and laughing with you one moment, then being deceased 20 minutes later is one heck of a roller coaster ride. To clear up a few quick points, the NG tube was attached to a canister on the wall and set to suction to help remove contents, and the patient most likely aspirated. Think about when you eat and cough swallow at the same time and the food goes down the wrong pipe equals airway versus the esophagus. After he pulled his tube out enough that it slipped out of his esophagus and thus allowed the contents to flow down the airway. I hope this clears things up. Sorry for any confusion. And thanks for the great questions and discussion. I'm doing my best to get to them during work. Well, there's a new way to die I didn't know to be terrified of. My husband is a PICU nurse and one morning he came home in a bit of a daze. I asked him what was wrong and he told me about a little boy who had been in PICU for a few days already and wasn't getting better. Most nights, the little boy would wake up so one of the nurses would keep him company while he fell asleep again. My husband was doing just that. He read him a book then just sat there with the boy listening to music so he would go back to sleep. Before falling asleep the little boy said you were my favorite. The boy passed away in the morning. His little heart gave out and refused to restart. Although all patients are important, some leave more of an impression than others. Until that point, that little boy hadn't stood out to my husband and he felt terrible about it because, clearly, he had made a big impression on that little boy. That was the only patient's funeral he has ever attended. You were my favorite. Well crap. I'd be crying myself to sleep for a week. Not a medical worker, but my friend's husband was dying from cancer. He'd done lots of chemo and one surgery and overall his prognosis looked really good. He'd gone through another surgery and he was due to be released from the hospital a couple days after this story takes place. My friend had been with him and was going back home to sleep for the night. Just before she left his room, he said, "I'm going to miss you my love," and obviously she thinks nothing of it, saying, "I'll miss you too." I'll be back in the morning. Couple hours later he was gone. The morning my stepmother died of cancer she told me, "Thank you for everything you do for me," as I was her caregiver whenever my father wasn't home. Like your friend, I never thought any of it either, but looking back I'm sure she knew that would be her last morning with me. Not a medical worker, but I knew a guy from middle school who had a degenerative disease and he knew he'd die young. It was New Year's Eve and he'd just gotten out of the hospital for the 3rd time in a few months, so we were partying at his apartment. Somehow I ended up being the last person there with him and his girlfriend, and we were pretty drunk and got to talking for a while about how great the party was, how much nice it was to have friends like ours, plans for the future. All of a sudden he said, "God, I wish I had more time. I always thought I'd have more time." Not his last words, but they're the ones that stuck with me. We weren't close by any stretch, but I always wished he had more time too. He was so friendly and kind, the type of person who made you feel like their closest friend even if you were a total stranger. He was a good man and he deserved a longer life. Imagine the perspective he lived life with. I can't really comprehend it. RN here. We had a patient on our unit for a year almost. He was so mean. Thought we were always hurting him when we tried caring for him. Every interaction was very unpleasant. Well, I just had a bad breakup and was the world is ending depressed. The day he died he was calm and asked me if I was married, which at the time made me kind of sad. So I just answered no, I'm not, and he just said, "You'll find someone. And I know you aren't trying to hurt me." It was so concise, to the point, and memorable for me. Honestly, it was the sweetest thing he could have said to me, and given the scenario I would say it was the sweetest thing anyone has said. On his deathbed, no formalities, just telling me what he had always wanted to talk to me about. I cried when I left his room, and he passed away right at 7 PM when my shift ended, so I got to be with him. Had a patient that kept coding, but every time they came back they'd get crazy strong, fight everyone, and then start saying the Lord's Prayer. They'd trail off and code again. Another one snatched me by the arm and pleaded that they wanted to see their baby grow up. 60 seconds later I was pumping away on their chest. In my line of work I hear a lot of last words. These two though surprisingly weren't the final last words. I just thought they were, and at the time it was a perfectly rational thought. Of last words, my favorites were always the "I want you to go away and leave me alone. I'm going to sleep. Goodbye." Family members didn't pick up on that one, but that patient and his eyes said it all. Code equals code blue equals heart stopped breathing equals dead. Years ago I had a patient who had dementia, but was also aphasic due to a CVA. She was a DNR. Anyways, I went in about an hour 45 minutes before my shift was up to check her over, make sure she and the room was good for the next shift. However, this time she seemed really interested in trying to talk to me. This was unusual. She didn't seem like she was in duress. Versus looked good and she had no signs of pain or discomfort. Turned her, fluffed the pillows, new linens, made sure she was clean and dry. I tried my best to gather some grasp of what she wanted, but to no avail. I spent the better part of the last part of my shift trying to figure out what she was trying to tell me. Eventually, I got called out of the room to help another patient. Just before my shift ended I got a call from the monitor tech asking me to check the telemetry leads on her as they weren't getting a signal. I go into the room to find her asystolic. She had died in the 10 or 15 minutes from when I left the room. She had no family to speak of. She was a DNR at that point and it wasn't that much of a surprise. But I often wonder what she was trying to tell me, and I feel a lot of guilt that maybe I missed something and that ultimately she died alone. Still haunts me. I'm an emergency nurse, and there's one thing that always gets me when patients die. Not what they say, but what their husband, wife, parents say when they've gone. I've had it a few times, but the most memorable was a man in his 70s whose wife had just passed away, and he was holding her hand and crying. And he just looked up at me and said, "I've loved her for 55 years. She's my whole life. What do I do without her? It breaks me every time." RN here. I don't remember this guy's admitting diagnosis. He wasn't assigned to me, but my co-worker asked me to help start an IV on him. He needed a unit of blood and his peripheral access had gone bad. I placed a tourniquet and was ready to stick. Then he looked at me and said, "I'm dying." Immediately went unresponsive. I checked his pupils. I watched one dilate and the other constrict. We coded him. Never got him back. As a former EMT, I can't count the number of people who said or screamed I am dying in the back of the ambulance. But I always could tell by the look in the eyes of the ones who really knew it and were not just panicking. I'm not a medical worker, but on the 28th of February of this year we had a bad ice storm in Oklahoma. I had no choice but to go into work and I worked 45 miles from home. The roads were awful and a solid sheet of ice. I witnessed a car accident, a double tractor trailer semi versus a Ford Focus. I had to stop because of it and I slid to her immediately. My dad is a retired firefighter EMT and my mom is a nurse, so I wanted to try to help if I could. When I got to her, she was hanging out of the driver's side window and the back of her head on one side was missing. When I went to feel for a pulse on her wrist, she grabbed me, even though she was unconscious. She was gurgling and wheezing. I stayed and held her as she died. I listened to the gurgling and begged her to open her eyes, and she wasn't alone. That was the worst thing I heard. Her gurgling and death rattling. Obligatory, not a medical worker, but I think my grandpas qualify for both the most haunting while at the same time being absolutely hilarious. He was diagnosed with stomach cancer when I was 16. However, due to the type of cancer it was and how it had metastasized, treatment wouldn't be effective. The silver lining was that it was otherwise a very slow-moving cancer. We knew he would die from it, but he still had years left. My grandpa was also the cheeriest, most fun-loving and jokey guy in the room, and even with a diagnosis, was still in high spirits throughout the rest of his life. I think the fact that we all still had time left with him after the diagnosis really helped with that. Cut to the Christmas after I turned 22. My grandpa's been in hospice care for the past 8 months. He's gotten to the point where he may pass any day now, so we're all visiting him regularly, so there's always a few family members with him, but since it's Christmas we're all there. 15 people crammed into what is effectively a small dorm room. Because it's been years now, all the tears have been cried. Everyone has more or less come to accept what is coming, and really we're all just chatting with him and spending time with each other. It honestly has the feel of after dinner family time. Now a side effect of the cancer at this point is that he's burping up this nasty stuff every so often, so he doesn't talk as much at this point. Not because he can't, but because it's painful, because he has such a sore throat from the sick. Now the whole family is chatting and my grandma is sitting on my grandpa's bed holding his hand. It's warm and cozy, and eventually this soft lull falls over the room. That's when my grandpa pipes up in a voice that is much tougher and gravelly than usual. "Is it dead in here or is it just me?" And with that, he patted my grandma's hand, laid his head back on the pillow, closed his eyes, and went limp. It was astounding. And just a few seconds after the initial shock sunk, everyone in the room immediately got the giggles. My grandpa was so loving and such a cut up, it seemed only fitting that he left us with one last gag. R.I.P. go. I had a guy who had a cardiac arrest in a swimming pool. He came to my IQ. The lifeguards has managed to get him back at the poolside, so a short downtime, which usually means a good thing. It turned out he had a dysarrhythmia, funny heartbeat, which had resolved. So, we woke him up from his medically induced coma, and he was great. Smiling, waving, talking. He remembered feeling unwell in the swimming pool, etc. Fast forward 2 hours, and his nurse starts shouting for help. The guy is screaming and really agitated. He grabs me and looks me square in the eyes and shouts, "Something really bad is about to happen." I have never seen fear or panic like it. He pulls out all his lines. He bites through his arterial lines, so he's losing blood everywhere, and he's standing on the bed screaming. We cannot calm him down or reassure him he is safe. He just screams and shouts and panics, and then he stops, collapses and goes into cardiac arrest and dies. In the medical profession, we talk about a sense of impending doom. I now work in palliative care, so see lots of people who die, but this was so visceral. He was so scared. It was harrowing. I will never forget the look in his eyes. Occasionally my ADHD meds combine with a poor night's sleep or inadequate hydration and produce tachycardia. Sometimes, that comes with a very clear sensation, with a very vague meaning, that something is very wrong. I think I can imagine that, at a far greater intensity, with a far more serious heart problem, producing that kind of aura plus panic attack. I'm a nurse. I started off working in pediatrics. Toward the end of my first year, this woman came in with her 8-year-old daughter who was feeling dizzy and had a poor appetite. She hadn't had her flu shot and it was flu season. So she took her in because her symptoms were bad enough she was worried that she may need medical intervention. So we asked her a few questions. Then I noticed this huge red bruise on her side that covered half of her side. I noticed another one on her back when we went to check her heartbeat. Then she fainted. We were able to get her stable, and when she woke up she said she was just feeling weak. Because we were thinking flu, we got her hooked up to an IV. I mentioned the bruises to the doctor and he asked the mother to leave so we could talk to the little girl in private. Is there anything you want to tell us now that your mother's not here? She nodded and looked down shamefully. We asked her what, and that's when she told us that she was bleeding. She admitted that for a month she had lots of nosebleeds at school, at least a few times a week. And then she showed us something that terrified us. She showed us an ulcer she had inside of her lip. We went from thinking flu to abuse to cancer really fast. We sent her to get some tests done ASAP and never heard her back. A few weeks later I transferred to St. Jude's. Turns out she was getting treated there and her tests came back positive for leukemia. She was not doing well. I was working as a chemotherapy nurse right away and would work with her a lot along with a few other patients. She just got worse. Before one session she looked at me with the saddest eyes and said, "I don't think I'm going to live for much longer. Tell my mom that I love her more than anything and anyone else." It was so heartbreaking to hear. But nurses have to be stoic and I had to suck it up. After that session another nurse took over and I ran outside and broke down crying. She died that night in her sleep. May you never have to hear such a thing again. Not a healthcare worker, but my grandfather passed this week at 89 years old. He was a very sharp, sane man, not senile or any dementia. The 2 days leading to his passing he began to see things. He told me, "Do you see Michelangelo painting?" I said no. He said, "He is painting invisible dust. Everything he paints disappears. I hope the bathroom is still there." He also told us he could see little men jumping from the fan blades. It was really strange. It sounded like he was tripping acid, but obviously he wasn't. He prayed over and over the night before he passed. We found him deceased in the morning. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.